Are you suffering from speech delay issues, or are you suffering from issues like speech clarity? Is your child an autistic kid, or is your child having apraxia of speech? Then please hook into the video and wait till the end, because here we are going to provide you a few small solutions to all your problems that you are having related to speech. Because here we will be showing you practical demonstrations that we have done on our child, and we are getting good results from our child relating to speech. So we will be discussing over here about OPT tools, OPT therapies that we are giving to our child. We will be having two parts of this video. This part will consist of the OPT tool related activities that we are doing with Koirov, and in the next video we are going to come up with the activities related to OPT, but which we are doing using household items and spoon specifically. And next, with that, we will also be giving you a few massage related ideas that what we are doing with Koirov. We have 4 or 5 massages. So with that also, I will be coming up with another video. So please stay with us and look into the entire video, because we are autistic parents and we are also suffering from apraxia of speech. So we have seen various difficulties related to speech, and slowly now we are finding some improvements in speech. So we have come up with this video. So please stay on and hold your breath till the end. Hello and welcome to the channel Autism with Koirov, and today here we are going to discuss about apraxia and OPT tools as said earlier. So now let's start with the video, and first what we are going to discuss is apraxia of speech. So what is apraxia of speech? It is an issue or a problem where a child cannot coordinate with the muscle movements of the cheeks, tongue, lips, and chin. This is a major problem that many autistic kids are facing. So they are having speech delays, or they are also having language delays. So this apraxia of speech is really a difficult issue to work with, and we are really facing various challenges when we are wanting to make our child speak. Usually, in apraxia of speech, they face difficulty to plan and coordinate among what they will be speaking and how they will be speaking. Maybe they know what they want to speak, but they cannot coordinate their facial muscles to make the entire speech, thought into a speech. That is a major issue that the children are facing if they are having apraxia of speech. We will be discussing now about what is OPT. OPT emphasizes on the precise placement of the tongue, lips, and chin and cheeks and the jaw when we are wanting to speak, usually to formulate the speech in a proper way and to bring clarity in speech. If the speech related activities are clear, then in that case the hyperness, the issues of a child gets reduced a lot. It focuses on the sensory awareness and motor learning techniques, helping the child produce proper sounds and formulate the proper way to speak words. Now let us discuss about the OPT tool activities that we are doing with our child. Now we will be demonstrating one after the other about all the OPT items that we are doing with our child. First, you can see we have a electric brush with us. This is a Oral-B electric brush. We are not promoting, it's just to show you exactly what we are doing. You can see in this video that exactly what we are doing with our child, how we are using this electric brush. When we use the electric brush, then in that case it gets a proper massage in our child's muscles. So you can see through the video that what is actually happening when we are providing this electric brush. And do not use this electric brush more than 2 minutes whenever you apply it on your child. Whether you are applying it on the cheeks or whether you are applying it on the chin, use it for maximum 2 minutes whenever you are using this electric brush, because first and foremost it's a vibratory movement. So electric brush, the vibratory movement can be taken by the child and does not affect the vocal cords or the cheeks internally if you use less than 2 minutes, but more than that it should not be used. You can keep using this regularly for 2 or 3 times a day or in a gap of 2 to 3 hours a day, because facial massage is very important for a child. Use this regularly and you can obviously see a kickstart in your child. So this is a very important oral instrument that we have bought for Koirov. Next item, we are using this TTUD pink brush. Here you can see over here that there is no spring. This is the first instrument that we had bought, and we have seen that the tongue movement becomes very nice when we are using this. This TTUD instrument that we are having, this is a tongue lateralization and elevation tool. Through this, what happens, as you can see in the video, the tongue control comes, or the tongue movement comes. When a child is not having any tongue movement, at that time this instrument is used so that he can understand how much to move his tongue up and how much to move his tongue down. And he can utilize this speech instrument to easily form words like la, which is a total word that comes through the tongues. So various words that uses tongue is made easier when we are using this TTUD instrument. This is a primary instrument which does not have any spring. But after that, we have started using another instrument which is TTUD with spring. This is a cyan color TTUD instrument that we are using for Koirov, and over here you can see that there is a spring. So here the spring is present, and this is the ball that you have to push up and you have to leave so that the tongue allows it to fall down. So this is another instrument that we are using when as you can see through the video, that so that the tongue control comes. First, when we are using the pink color instrument, at that point, pink color TTUD tool, at that point of time, what is happening? It just initiates the tongue movement. But through this TTUD blue or cyan color instrument, we can bring control in the tongue movement so that there is a confidence in the tongue movement of the child. So therefore, this instrument is very, very vital for using when you are wanting to start OPT with your child. Now, next item that I am going to show you is a UNI-TIP. This is very useful when the tongue moves out of the mouth repeatedly. You will see many kids do not understand that they have to keep the tongue inside the mouth or inside the lips. What happens repeatedly, the tongue starts coming outside, and it looks very awkward when they are speaking or when they are just sitting but their tongue is coming out. So at that point of time, what happens, you can give sensory input using the tip. Over here in the UNI-TIP, you can see all the 4 sides are of 4 types. So this UNI-TIP, as you can see in the video, you can take the UNI-TIP and you can move this UNI-TIP repeatedly inside, as I am doing in the video, and using this UNI-TIP item you can control the lip moving outside the lips or outside the mouth of your child. This is a very useful tool, and I can say you that we have used it for maximum of 2 weeks and the problem has got solved. So this is very important tool that you can use with your child. Next item that I'm going to show over here is 2 Chewy tubes that I have used for my child. First, I have used this green Chewy tube. You can see there are sensory input holes over here. There are bumpy. It's a bumpy item over here, as you can see, as well you can see in the video also that through using this you can start making your child chew and bite properly. Using this, what happens, the biting tendency that a child does not have, that comes in primarily. So that this entire part moves properly, this movement comes in properly and controlled movement comes in. That's why you can make various activities done in your child. Now, as you can see in the activity that I'm doing, it's a rhythmic control activity which says that continuously you are going to tap, say suppose 1 2 1 2, and your child is going to bite 1 2 over here inside the mouth, and over here with the teeth 1 2 over here. So in this way you can control your child's jaw movement, and slowly the child starts developing a sense that yes, how much he needs to move, and along with that this area gets stronger, the jaws get stronger so that they can start speaking properly. And another thing that we have seen in our child using this that has come in, once we have started using it and we have utilized it for about a month or so, we have seen that previously Koirov did not used to eat fruits. So he did not used to chew fruits. But once I've started using this item, I have seen that his chewing tendency has developed. Previously, he did not used to chew fleshy items like say chicken, or if there is any elastic type of any fiber that we are giving him, then that he did not used to chew. So that has also developed once we have started using this item. This item's usage finishes off. Then comes this item, which is having a plain body. It is for heavy chewers. So the sensory problem that the child is having gets solved using the green one, and then this B-arm opt Chewy tube comes into, which is of a cyan color or a blue color, and you can utilize this one so that he can move his jaws to speak properly, and his confidence develops so that he can speak in proper sense. So in this video I have shared with you all 6 items, that is 2 TTUD tools, 2 Chewy tubes, 1 electric brush and one UNI-TIP that we are using in our child. So we have seen various improvements in our child, and we have consistently been using it for about 1.5 years time now. But yes, the frequency is if the more the frequency that you can give to your child, the more frequently you can use this tools in your child, you will see improvement in your child. And we are continuing the usage of all these items till today, and we have seen improvement in speech. We have seen that he has started speaking slowly a few words, and he is trying to vocalize himself. He is trying to start speaking slowly and steadily, but you have to keep patient, and you have to keep trying so that your child speaks properly and gets the confidence of speaking. So for the next video that is coming very soon on the OPT activities or OPT therapy activities that we do using our household items and the massages, please stay tuned with our channel so that you can keep getting our videos. So please like, share, comment and subscribe on the channel so that you can keep getting videos that we continuously post. Thank you so much.